would like to thank the distinguished representative of the International Organization for Migration. We have concluded the list of speakers under agenda item 4 for this meeting. We still have some time remaining, and I will therefore go back, with your permission, to agenda item 3 on actions in follow-up to the recommendations of the International Conference on Population and Development, and now give the floor to the non-governmental organization, the World Youth Alliance representative, to make a statement. You have the floor, ma'am.
Thank you, Mr. Chair, esteemed delegates, and members of civil society. The World Youth Alliance, a global coalition of young people promoting the dignity of the human person in policy and culture and building solidarity between young people of developing and developed countries, welcomes the themes of the Commission: health, morbidity, mortality, and development. We are convinced that people are the most important driver of development, and that human creativity is a critical resource and a catalyst for development. As such, development requires the promotion of social, political, and economic environment that allows persons to reach their full physical, spiritual, mental, and emotional potential. Ensuring access to high-quality health care that adequately addresses communicable and non-communicable diseases, prevention, and treatment is a critical component of this effort. As young people committed to the health and development of the world's people, we wish to call attention to the areas we see as critical to addressing these issues: locally driven health systems, maternal health, and the health needs of young people. Comprehensive primary health care that is informed by local priorities and structured based on cultural realities must become the focus of international health efforts. For too long, health priorities have been donor-driven and focused on investment efficiency. This has slowed progress in the establishment of permanent institutions that promote community health through disease prevention, early detection, and treatment. Renewed emphasis on locally driven health systems is essential in light of growing disease burden associated with non-communicable diseases in all parts of the world. Where acute health issues associated with malnutrition, clean water, and sanitation, the vector-borne diseases have largely been addressed. Health systems must be flexible enough to address chronic disease prevention. We call in a particular way for programs aimed at young people, particularly young men, to address substance abuse and other high-risk behaviors that lead to high rates of mortality among this subpopulation. We call for a review commitment to the achievement of the MDG 5. Too many young women continue to lack access to adequate prenatal care, skilled birth attendants at delivery, and adequate postnatal care. Globally, this is a major immediate cause of maternal mortality and morbidity. The strengthening of healthcare systems to ensure access to skilled birth attendants, proper equipment, and the ability to refer women for and deliver emergency obstetric care should be a resounding recommendation of this Commission and a priority for all nations cooperating for the delivery of maternal health care. It is a disservice to women that family planning to avoid mistimed or unwanted pregnancies is proposed as a cost-effective intervention to reducing maternal morbidity and mortality, where access to adequate obstetric services is still limited. This is not a substitute for adequate obstetric care and fails to respond to the pressing needs of women around the world. We urge this Commission to address maternal health distinctly from reproductive health. The combination of these issues has led to investments that make it easier for women in developing countries to avoid a pregnancy rather than to have a healthy pregnancy and delivery. Finally, we call on the nations, in partnership with family and communities, to promote to the fullest extent the health, well-being, and potential of all children, adolescents, and youth. Young people face unique health issues, many of which are intimately linked to the health and well-being of their families. As such, solutions to address their needs must encompass the family and the community as a whole. The health of women and mothers is a key factor in child health, where proper prenatal care, including nutrition, is a critical determinant of healthy birth weight and the long-term survival of children. Programs that offer treatment to HIV-positive women to prevent mother-to-child transmission of HIV/AIDS, or that prevent instances of vector-borne communicable diseases in pregnant women must be available where needed. Parents and those responsible for the care of children and adolescents must be supported in creating conditions to promote child health through access to nutrition, health education, and other primary health programs. This also includes the creation of an environment in which children can develop their athletic and artistic talents as an avenue for both physical and mental health. We call upon the Commission to reflect these recommendations in the resolution on health, morbidity, mortality, and development. Thank you.
I would like to thank the distinguished representative from the World Youth